I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to our Commissioners Board meeting for Thursday, January the 24th. We are broadcasting live via Microsoft Teams live event and also broadcasting on BCTV as well as Facebook and YouTube Live. At this time, I'd like to recognize my Executive Assistant, Mary Buer.
Thank you. Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by the limitations of the platform being used, Teams, Q&A, Facebook, or YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much, Mary. At this time, we will begin as we do each week with a moment of silence followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. This morning, in accordance with state law, we are hosting a public hearing. This deals with the Human Service Block Grant for fiscal year 2021 and 2022. At this time, I want to recognize Pamela Seaman. She is the Berks County Mental Health and Developmental Disabilities Program Administrator, and she is going to present the public hearing. Pamela.
Good morning, and thank you for allowing us to come to present today. So every year we have a public meeting for our block grant funding. It's for our plan that we are going to submit for the next fiscal year. Next slide, please. So the various funds that come into our block grant funding are shown on this screen. Since 2012, Berks County has participated as a block grant county, allowing us to have some greater flexibility in the use of state funds in all of these areas. Next slide. Wanted to start out just with a little bit of a recap for the current year. As many people, many programs, many areas have experienced challenges, we are no different. We had many challenges that occurred across the board for service delivery because of the continued experience of the pandemic. Some of the things that led into how we, were able to deliver service was that some of our state program areas that fund us sought federal waivers that allowed us to have a little more flexibility in how we delivered service. The really amazing thing was how providers responded promptly with flexible, adaptive, and really creative measures to try to continue to meet those needs of people that they were already supporting and new referrals that we received. I included early intervention in here. That's not one of the block grant funded areas, but it is one of the services that we cover. And early intervention services are for very young kids, birth to 3 years of age. And we continue to deliver services throughout the entire pandemic, mostly using the coaching model, which is a model where we, as professionals, teach parents how to provide interventions for their kids. Mental health services and drug and alcohol services were offered primarily via telehealth, although, again, based on needs, there were varied levels of care that were either delivered in person or telehealth or a combination of both. On our developmental disability side, we delivered services remotely for our day programs as best as we could. We still are trying to implement and get those all back up and running slowly but surely. And our community living homes or our residential homes were greatly impacted by the illness of residents and staff. Next slide, please. So again, as I mentioned in a previous slide, there were a lot of things that our funders actually did to help us. And one of those things was creating alternative payment arrangements and also enhanced service rates to try to keep providers financially functional, just so they could continue to deliver services, even though through different means, and also to make sure that when we came out of the pandemic, we still had provider agencies who were going to be part of our network. Federal and state funds also became available during the pandemic. One of the areas that we cover in the block grant is HAP, or Homeless Assistance Program. And with the availability of the funds such as the ERAP funds, some of what we had to do was kind of move things around just because there was greater flexibility, greater eligibility in some of the new funds that came through. So that was a good thing, just had to be flexible. Next slide, please. So the block grant implementation. Next slide. Our consolidated planning process, and the reason we're all here today is, as I mentioned, on an annual basis, we actually submit a plan to the state, and it's due at the end of July this year. We pulled together a leadership team to really take a look at all the strengths and needs of our human services system that are touched by the block grant funds. The information that we actually use to put our plan together is really collected from a number of sources, and not just right now. We collect that information throughout the year. We want to definitely include input from people who are utilizing the services, family members who are involved with service utilizers, advocates, but the individuals on our leadership team that put the plan together include representation from the single county authority, the developmental disability community, the mental health community, our health choices program, and the homeless assistance program. Kathy Knoll from the Council on Chemical Abuse is also present today, and I'm going to have her speak in a few slides. Next slide, please. So one of the things that I did want to point out is, despite all of our efforts to look at everything in a manner as flexibly as we could, one of the things that has definitely, I wouldn't say been problematic, but we've definitely seen that in all program areas across the board, there were decreases in the number of individuals who were actually accessing services and the volume of service requested. So even those people who've been connected and involved in service, they just really used less. Again, some of that was based on what was accessible. Maybe the service wasn't a service that could be delivered in a virtual platform. And again, because of just all of the concern about spread, services were really minimized. So with all that, our fiscal forecast for block grant funding through the end of June indicates a strong likelihood that for this current fiscal year that's going to end at June 30th, that we'll need to return some funds to the state, which is highly unusual. We've never really had that experience in the past. But in my talks with all the other county administrators, this is across the board, across the Commonwealth. We don't expect that going into next fiscal year that we'll have the same situation. Actually, we're starting to see that, people are really starting to come out and starting to access service now. So again, we think next year we'll kind of be back to what was normal before, but did want to indicate that we may need to return some money this year. Next slide. I'm not going to go over all the different areas, but this is where some of our mental health and developmental disability services, where the dollars go into. And you can see we have to use numbers for people served from 1920 because our year's not complete yet, but the allocations that are shown are truly allocations that we received for the current year. Next slide. Our human services development funds are another piece of the block grant funding, and you can see that's a much smaller amount, but it actually touches a lot of people. Only 322,000 that actually impacted 988 people. Next slide. And our homeless assistance program, again, a smaller amount, but impacting about 504 people in 2019-2020. Next slide. This is where I'm going to turn it over to Kathy Knoll from the Council on Chemical Abuse, and she's going to speak a little bit about the drug and alcohol system. Kathy.
Thank you, Pam. Good morning, commissioners. Before I begin, I would just like to let you know that Stan wanted to be here this morning, but couldn't be due to a death in his family. But again, I'd like to thank you for allowing me to be here to talk about the drug and alcohol services funded by the block grant. So funding for drug and alcohol services comes from the Behavioral Health Services Initiatives and the Act 152 allocation. These funds used to come directly to COCA, but now are part of the block grant. And the opioid use disorder funds that you see there were new for us this year, and were used specifically to combat the opioid epidemic by providing intervention and treatment and recovery support services for people who have an opioid use disorder. So as you can see on the slide, in fiscal year 1920, we were able to provide drug and alcohol services to more than 3,000 Berks County residents with block grant funds. And as Pam said, this year, because of the pandemic, there was a decrease in the demand for drug and alcohol services as well. And so our block grant budget for drug and alcohol services for this fiscal year is almost $1.5 million. And again, although our providers were also very creative and flexible, there was a reduced demand for the services. So we know too that we're not going to be able to expend all these funds this year. Again, that's very unusual for us. We're usually contacting MHDD saying, hey, is there any funds that, unexpended funds that we could use? Because the partnership, because of the block grant, has allowed us to provide more services for more people. And again, on the drug and alcohol side, we're seeing the same thing. As the pandemic is easing, we're seeing more and more people coming out and requesting services. Next slide, please. So in the midst of this pandemic, it might be easy to lose sight of our continuing opioid crisis, but we know that it hasn't gone anywhere. During the year 2020, there were 134 overdose deaths in Berks County, which is the highest number of overdose ever here in Berks. And unfortunately, just looking at the coroner's report through May 2021 looks like it could be even worse. So one of the things I wanted to take just a moment to highlight some of the ways that Berks County is working to impact this crisis. As you are well aware, our opioid task force, SOS Berks, under the leadership of Commissioner Barnhart and Stan Papdemetrio, continues to be at the leading edge of this fight. So one of the things that we're continuing to do is to distribute Narcan kits. In addition to distributing these kits to traditional first responders, 236 Narcan kits were distributed to community members in fiscal year 1920. And even during the pandemic, we continued to be able to distribute these kits. At this point, we're really doubling down on getting more Narcan into the community. We know that the African American and Hispanic communities have been disproportionately affected by overdose deaths. So we're really reaching out to those communities in order to get more Narcan and more information about treatment. The other program I'd like to highlight is our Blue Cares program. Blue Cares is a program in which when a police officer is involved in reversing an opioid overdose, a police officer teams up with a recovery support specialist. They pay a visit to the overdose survivor. They offer immediate treatment. They offer information for the overdose survivor and for their families. We were able to continue this effort during the pandemic. We had less face-to-face interaction and more phone calls. And now we're currently back to face-to-face interactions with Blue Care visits. And finally, I'd just like to highlight the Berks County's Warm Handoff program. It's run primarily out of the Reading Hospital Emergency Department and operated by TASK. It's staffed 24/7 by recovery support specialists who intervene with people presenting in the emergency room. And when we first started this program, it was just for overdose survivors, but we quickly expanded it to any person with a substance use disorder. And the goal is to really move the person from the emergency room directly into drug and alcohol treatment. So in fiscal year 1920, 1,131 people received the service, and almost 60% of people actually accepted a referral to treatment. So there are many continuing efforts to combat not only the opioid crisis, but the overarching problem of addiction. And without the block grant funding, we would be able to reach so many fewer people. Again, I thank you for allowing me to be here to present today, and I'll turn it back over to Pam.
Thanks, Kathy. If you could go to the next slide. So again, one of the things that was mentioned at the beginning is the Human Services Block Grant participation allows us to have flexibility. So just like Kathy said, sometimes we're able to move funding around. This year, again, because everybody's experience has been they've been spending less, we really only needed to move a small portion of mental health funds to the Human Service Development Fund services. Next slide. Retained earnings. So one of the things that we are allowed to do is if we don't have all of our allocations spent is we can keep 5% of that amount of money and submit plans to the state for approval, basically allowing for one-time only purchases or startups of things. So last year we used our retained earnings money to continue with the development of the Windmill Forensic Project. That's a project that is specifically devoted to trying to divert individuals who are either incarcerated or currently on a forensic inpatient state mental health unit to get them into treatment rather than incarceration. That program truly opened and took the first person just this week. So we're excited to get that moving along and hopefully, again, steer people in the direction of treatment rather than incarceration. The other thing that we used the retained earnings funds for were some suicide prevention activities. That was one of the things that we really tried to do, knowing that people weren't necessarily getting into service, was really putting information out there like we've done in the past about the availability of services and how you can get services, and also really trying to make sure, especially during this pandemic time, that people are checking on others and asking, our standard line, are you okay? And if they're not, helping people to connect to the right place. So those were our retained earnings plan from last year. Next slide. One of the things that happens when we submit this plan to the state is they actually give us follow-up feedback. And these were some of the highlights from last year. They noted that we have a very comprehensive and well-funded reinvestment housing plan, that we have a very comprehensive continuum of service. We've got a great focus on transition age youth. We have outpatient mental health services in all of our school district buildings and in our local community college. And we've got MAT access, the Circle of Excellence, Opioid Task Force. So those were all highlights. Again, there were other things, but those were the standout ones. System needs, we continue to need some assistance with supported housing. Extended acute services are inpatient psychiatric services beyond an initial inpatient stay, but before a state hospital admission. We need additional Medicare providers in our network, especially for outliers in our county, closer to borders of other locations. Sometimes it's hard to find Medicare providers. And then just looking at expanding our service provider network for individuals with both mental illness and substance abuse disorders. Next slide. So some of the things that we're taking into consideration right now as we do this planning is, again, what are our program gaps, our service areas that we need to focus some attention on? How do we think things are going to be different in the post-pandemic environment? What do we do? Again, we expect that some of the tools that were added to our toolbox during the pandemic, like telehealth services, will continue, although they may have a more narrow scope. And again, it's great to have those services available, but we also recognize the fact that some people don't respond to telehealth and that we have to have other ways to get people engaged. Again, mental health concerns post-pandemic, what the state budget's going to look like going forward, no one really knows. And then retained earnings, just like I spoke about, and obviously we know we're going to have money that's unspent this year, so we will definitely be looking at what can we submit retained earning plan process to the state. Next slide. So that's it for me, and Kathy speaking on her behalf. If you have any questions, again, if you could let them get to us. My contact information is there, also our telephone number. And also if, you know, as a community member or advocate or person that's working in the service system, if you identify any service system needs, please let us know. I mean, that's why we have this hearing, is because we want to get public input. That's it. I'm done. And thanks again, Kathy.
Thank you very much, Pam. Thank you, Kathy. I would open it up to my colleagues. Are there any questions or comments?
No, as always, an amazing job by our staff here, both at the MHDD and COCA. It's always good to get an update on an annual basis, if not more often. But thank you, ladies.
Yep, no questions, but also want to thank them for the work that they do, something that's really needed. So thank you to both Pam and the group at COCA as well.
I will accept a motion on the resolution tied to this public hearing.
So moved.
Second.
Third.
The motion has been made and seconded, and for those that may not have the agenda in front of them, this is to adopt a resolution authorizing execution of Appendix A for fiscal year 2021-2022 in the County Human Services Plan Assurance of Compliance form. Is there any discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The motion is carried. With that, thank you, Pam. Thank you, Kathy. And we will move to our next report. This is the weekly Berks County COVID-19 data report. And we have Brian Gottschall, our director of the Berks County Department of Emergency Services, to present. Brian.
Sorry, Commissioner, you caught me off guard. I thought we were doing the pledge and the moment of silence.
We did that already.
My bad, I apologize. And I'm having a little problem with my PowerPoint presentation here.
Just use hand signals.
Yep, I'll tell you what. I'm seeing the spinning wheel of death on my PC here, so we're going to have to—
I'll tell you what, work on that. I think that Commissioner Barnhart can switch up here. And Commissioner Barnhart, why don't you give your Cook County Wellness update, as well as an update on the Berks Cares Vaccination Center.
Sure, thank you, Commissioner Leinbach. So Cook County Wellness, we won't have a report. We'll have a double report next Thursday. I don't have anything in hand today. We are still promoting the Berks Cares Vaccine Center. Last week and this week, we've been pushing mightily hard with messaging and marketing to promote, to get people in the seats out there at the North Reading Plaza. Time is of the essence. We are going to be ceasing operations there on July 31st. The Cook County Wellness will continue to take appointments at 1-888-712-2772 through the last day of the program. We offer all 3 vaccines, the Pfizer, the Moderna, Johnson & Johnson. Make a note, July 2nd will be the last day for your first dose of Moderna, which is 28 days spread, and Pfizer's 21 days, and Johnson & Johnson, as everyone knows, is one dose. They are all 3 are being offered. We're strongly encouraging people to sign up now. Surprisingly, we've done over 4,000 doses total at the vaccine center, but more importantly, it's interesting, we were not encouraging, but we were taking walk-ins. Of that number, we had 1,100 that were walk-ins, which is a good thing. People decided, hey, while I'm out shopping, there's a vaccine center, let me stop in. We also have almost 1,000 scheduled for the coming weeks. So again, it's critically important you have the desire and the interest to get a vaccine. Now is a perfect opportunity to hit the Berks Cares Vaccine Center, because we want to assure that when you go there, you're going to receive your first and second doses of Pfizer or Moderna. We're trying not to have to send you elsewhere for your second dose, but if that's your decision, middle of July, you decide to get your first dose, we will ask you then through the Cook County Wellness 888-712-2772. We'll schedule your second appointment elsewhere, or help you schedule your second appointment elsewhere in the community. Again, part of the reason we are closing July 31st is the downturn in requests for vaccines. We know there are multitude of places in Berks County where you can receive the vaccine, which is good things for everyone. It's become so much more convenient. Berks Cares Vaccine Center, free bus service on Route 1 and 3, which is the 5th Street bus, the Kutztown Road buses, as well as paratransit, shared ride service, same thing. And we also are focusing through the Community Health Center on the homebound population with our area agency on aging. So that's what I have as far as a roll up with the vaccine center. Again, please, we're begging you, we have the capacity, we have the people. Get out to the North Reading Plaza adjacent to the Walmart, do a little shopping, get a vaccine, or get a vaccine, do a little shopping. So thank you, and I turn this back to either Brian Gottschall or Commissioner Leinbach.
Thank you very much, Commissioner Barnhart. And Brian Gottschall was able to work out the spinning circle of death on his computer and is ready for the Berks COVID-19 report. Brian Gottschall.
Yes, thank you, Commissioner, and thank you, Commissioner Barnhart, for stepping in and doing that in reverse order while I fix that problem. As always, we want to take a look at our cases and testing, and I'm actually starting to like this. For a number of months, I didn't enjoy doing this report because I felt like the bad news bear. However, things as they continue to look better, I feel better about giving the information now. So we see our case counts continuing to decline. In fact, we are now approaching the DOH set benchmark of 210 cases over the smoothing period as our objective. This is great news. It does, again, reflect back where we were back in the beginning of the summer last year. But I think we also have to consider the fact that testing is much more available, much more prevalent now than it was last year. So, we can't just say, well, it's looking like it was last year. Does that mean we're going to be back where we were again? We would hope that the prevalence of vaccine, the large number of people in our community that have been vaccinated are going to keep these case counts down. And we're not going to see a seasonal uptick as we move through the end of the summer into the fall again. Of course, something we all want to keep our eyes on and be prepared for the possibility of, but we need to remain optimistic and hope that we really are on the backside. Great news out of our hospitals. Again, as I always mention, this is a little bit out of date, and I apologize. The second week of 7/11 there should actually show last Friday's date. But we do get this information a little bit late, so we're reflecting last Friday's number. And these numbers include both known and suspected cases in-house. Great numbers, much diminished from where we had been, but even better news on top of the slide is in a conversation with some of the leadership of our local hospitals earlier in the week, we found out that St. Joe's, as of this week, had 0 patients in-house with known COVID, and Tower had 0 patients throughout the entire Tower system in ICUs with COVID. So those numbers are even better than the numbers that we're able to show on the slide for consistency. Our COVID deaths have flattened out over the last few weeks. We are still seeing deaths. We had an awesome period there of about 11 days consecutive with no reported deaths of Berks County residents. Unfortunately, then we did have a couple reports, and we're still seeing 1 or 2 a week, but clearly much better off than we were throughout even the recent few months, let alone back in the real thick of things. Our vaccine administration news also continues to look good. Again, we're 9th in the state, as we've mentioned for a number of weeks. We doubt that number will change because just due to raw population, it's where we belong in the list when looked at by population. But at the bottom of the slide there, where we look at the per capita information, we are continuing to make gains. Just in the last week, we're up 3 spots in each category, both fully vaccinated as well as at least first doses on board. And again, that information is as of DOH's reporting last Friday. A little bit of a change in how we report the vaccine overall. You'll recall that we've been using this slide, which was based on CDC data, shows that in Pennsylvania, we have about 59% of the population fully vaccinated over the age of 18. In Berks County, that's at about 53% of the population. However, then for this slide, where we wanted to look at kind of where we are at in Berks with respect to people that had first doses on board, and kind of what would happen if we just had nobody else start up, but just completed the people that did start it. we had to do some kind of data manipulation to get to these numbers, and we showed them as estimates. The good news is that as of recently, CDC is now reporting in both of those categories, both fully vaccinated as well as at least first dose. And now we don't have to do that data manipulation to get to the numbers that we want to get to. We can just show the actual data that CDC is now making available. That correction in not taking into account estimates, along with the fact that we're just doing better week over week, sees a fairly significant drop in our number of new residents 18 plus that we need to get vaccinated to meet our 70% goal. So right now, if everybody that has started the process just finishes the process, it gets us to 64.3% of the Berks County population. What we need to see is 18,600 new folks, 18 and above, step up and agree that now is the right time for them to begin to get the vaccine to help us to meet that 70% goal set by CDC and the governor. So just reiterating a couple of the things that Commissioner Barnhart already mentioned, our vaccine center operated in conjunction with Berks Community Health Center out in Muhlenberg Township is available for your use. We can assist you with that either by going to doyourpartberks.com where you can register, or you can call our 888 call center to make accommodations to register. It seems like every few weeks we change the walk-in language at the bottom, and we went from, we went from just scheduled to walk-ins were okay but not preferred, and we're now at the point where I think we're saying walk-ins are just as good as scheduled appointments. If you would like to go to the vaccine clinic and just walk in and get your vaccine, no problem at all, feel free to do that. And reiterating what Commissioner Barnhart said, just a reminder, we have about a week to a week and a half remaining, depending on whether you're talking Pfizer or Moderna, to begin the 2-dose vaccine regimen and still be able to complete that at the Muhlenberg Township Clinic. So if you're going to do the 2-dose regimen, it's a really good time to get that ball rolling. As we continue through the ramp down period in July, we will have the Johnson & Johnson vaccine available as a single dose option, but now's the time to begin if you want to do the 2-dose. And that's it, Commissioner. Thank you. And back to you if there are no questions.
Any questions or comments for Brian Gottschall? Okay, hearing none, we will move on with our agenda. Are there any additions or corrections for the June 17th Commissioner meeting minutes and the June 22nd Operation meeting minutes? Hearing none, the minutes will stand approved as presented. We did have an executive session yesterday, June the 23rd, dealing with personnel. Mary, is there any public comment on specific agenda items? I don't see any, so I'm going to move ahead here. Under the agenda, item 1, authorizing under that budget department, adopt a resolution authorizing 2020 budget transfers in the amount of $6,184,698 and 2021 budget transfers in the amount of $351,794 and 2021 appropriations in the amount of $211,168 per listing dated June the 21st of 2021. There are 2 items under Human Resources. Item 1, authorize the appointment of Cieda Joaquin to Senior Government Accountant in the Controller's Office. Item 2, authorize the promotion of Ashley Mellinger from County Caseworker 2 to County Caseworker Supervisor 1 in Children and Youth Services. There's 1 item listed under me. Adopt a resolution authorizing the appointment of Jack Williams, Reading, Pennsylvania, to the Area Agency on Aging Advisory Board to fill the remainder of a 2-year term, which will expire December 31st of 2021, and further authorizes the appointment of Mr. Williams to a 2-year term expiring December 31st of 2023. There are several items listed under the Commissioners. Item A, adopt a resolution authorizing the chair to execute the memorandum of understanding between the County of Berks on behalf of the Berks County Library System and the Reading Public Museum to partner for the installation and maintenance of Story Walk in the Arboretum grounds of the Reading Public Museum for a 2-year period beginning July 1 of 2021. Item B, adopt a resolution ratifying, confirming, and approving execution by the chair on behalf of the Board of Commissioners of a letter of support to Senator Patrick Brown, State Senator Stan Saylor, Senator Vincent Hughes, and State Representative Matthew Bradford requesting $1 million in the 2021-2022 state budget for the restoration of passenger rail service between Reading and Philadelphia. Item C, adopt a resolution ratifying, confirming, and approving execution by the chair on behalf of the Board of Commissioners of a letter of support to Governor Tom Wolf for the application of the Reading Baseball Club, Reading Fightin' Phils, for the Redevelopment Assistance Capital Program, RACP, grant for player and team facility improvements required by the new mandated standards set by Major League Baseball. Item D, adopt a resolution authorizing Christy Kennedy, Nursing Home Administrator of the Berksheim Nursing and Rehabilitation, to execute a letter of support to the Pennsylvania Department of Health, Bureau of Epidemiology for the Civil Money Penalty Reinvestment Application, offering a comprehensive respiratory protection program for licensed skilled nursing facilities across the Commonwealth of Pennsylvania. Item E, adopt a resolution authorizing Jennifer Brooks, Environmental Education Supervisor, Berks County Parks and Rec, to prepare, execute, and submit a grant application to the Giant Company, Greensburg, Pennsylvania, for the 2021 Healing the Planet Program guidelines to build environmental stewardship by connecting people and families to community green spaces, support environmental restoration, and community gardens. The county is applying for the full $25,000 grant amount. Item F, adopt a resolution authorizing the chair to execute a letter of support to the Deputy Secretary of Workforce Development of Pennsylvania, approving the final submission of the program year 2021 through 2024 Workforce Innovation and Opportunity Act regional and local plans for the Southeast Region counties approved by the Berks County Workforce Development Board on June the 18th of 2021. Item 2, a motion authorizing execution of contract agreements and amendments as set forth on the attached listing dated June the 22nd of 2021. There are a total of 17 contracts, 1 with the Area Agency on Aging, 3 with CareerLink, 8 with Children and Youth Services, 1 with the Department of Emergency Services, 1 with Information Systems, 1 with Juvenile Probation, 1 with Berks County Libraries, and 1 with the Commissioners. And then finally, a motion to ratify and confirm payments as set forth on the Controller's Office voucher listing. It's dated June the 22nd of 2021, and the payment of electronic transfers and employee payroll.
Motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. We'll move now to our treasurer's report. We have Dennis Adams, our county treasurer. Dennis.
Good morning.
Good morning.
We have an opening balance today of $228,603,231.58. We have a balance to clear of $5,893,646.07, leaving us a total today of $222,714,585.51.
Thank you very much, Dennis. We have the County Controller's report, but in the absence of our County Controller, her deputy, Drosna, is going to be presenting the report. Drosna.
Yes, good morning, Commissioners.
Good morning.
The total disbursements for the week of 6/24/25 were $9,647,586.48, which comprised of combined payroll of $4,496,237.30, and total accounts payable were $5,151,349.18.
Thank you very much for that report. We'll move now to Ron Seaman, our Chief Administrative Officer, for his report.
Thank you, Commissioner. We have nothing to report this week.
Okay, thank you. With that, we are at Commissioner's reports, and we'll begin with Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach. I know both you and Commissioner Rivera were pleased to be able to hand out CHIRP checks this week. The restaurant and tourism checks that came from the CHIRP fund was a very uplifting experience to meet many of our proprietors out there in Berks County. So it was a good thing we do here in Berks County to be able to try to keep these people solvent in their businesses with these grants. Last night, I visited Sadsbury Township in Lancaster County to view a Lancaster County Board of Commissioners meeting on the road. So I have some more information to provide to the board for our Tuesday operations agenda, which will consist of discussing the County Commissioners on the Road public meetings and the County Connection live programs. So I'll be joined by Stephanie Weaver and Heather Adams next week on June 29th at 9:30. So it was interesting. The meeting went for 2 hours. It definitely was entertaining at times, but also was very informative to help us format our proposal to go out on the road quarterly starting in September and then December of this year. So last but not least, at 11 a.m. today, we have Mission Vaccinate, which is a celebration of our employees who have successfully started or completed their vaccine process. We have well over 1,100 people here at Berks County, both today and tomorrow. Today is 11 to 2 downstairs. It'll look like a midday cafe. And tomorrow will be in the rear parking lot of the Berks Heim for the North Campus employees and parks and the MDJ system. So again, I want to commend those employees who step forward to do the right thing. I want to especially thank Jessica Blauser, my assistant, who just ran downstairs to make sure we're getting started. So if you'll beg my indulgence, if I don't stay for the question and answer session, I think if that's okay.
Sure.
Thank you.
Not a problem. You're okay with that, Commissioner Rivera, I assume?
Yep.
Thank you. Commissioner Rivera, your comments.
Yes, thank you, Commissioner Leinbach. A few things I want to let people know about is this past Monday, Commissioner Leinbach and I were at the kickoff for the Berks Agricultural Resource Network, the Barnopoly. When I asked IS if they could put the board up on there, Commissioner Barnhart was not able to go, but he is definitely supporting this as well. This is an initiative that the Berks Agricultural Resource Network is doing. It's a 2-month period between June 21st and August the 21st to go out and visit as many locations on the board as you can. There's some prizes and some other things involved with it. But apart from that, it gives you the opportunity to, one, learn about the many small businesses, farmers, wineries that are available in Berks County. It's also a great opportunity to do some internal tourism this summer. Many people go out and either do weekend trips or one-day trips. So this is a great opportunity to get out and learn more about the county and also to support our business owners and our farmers as well. You can register for it or get more information at berksag.org. That's berksag.org. So make sure you go in, find out more information on this and support this initiative. Also, this Saturday is the library's 35th anniversary. And let me just pull that up here. The library, Berks County Library System 25th anniversary. That will be held at Village Library at the Morgantown entrance of the Turnpike between 12 and 3 p.m. So if you have an opportunity, go by there. They're having, it's in chroma, it's some glasses that people that are colorblind can use to be able to see colors. So it's something that's really, really great. If you know of someone that's colorblind or you are, please have them go to the Village Library this Saturday between 12 and, between 2 and 3 o'clock. It's for the 35th Library Anniversary event. Also, I was just made aware of yesterday at an event that I was at that there's a scam going on in reference to the Sheriff's Office. There's someone that's calling and saying they're from the Sheriff's Office, indicating for you to do different things, and the person actually has information as to where you live, maybe some personal related items as well, and they ask you to stay on the phone, to not call anyone, not let anyone know, and if not, if you do hang up and if you're stopped on the way here, which are actually sending you to 633 Court Street, that if you're stopped, that you're going to be taken to jail and they can't help you, and so forth and so forth. Long story short, it is a scam. So if you do get a call from someone from the Sheriff's Office saying that you need to bring money, some things to be aware of that I reached out to the sheriff this morning, and he says that they are aware of the scam, and anyone that does receive a call, they're advised to let the DA's office know so he can try to help get these people. He also wanted to let you know that the Sheriff's Office will never call anyone on the phone and ask for money, never. And anyone who needs to pay a fine can only do so in the main office located on the 3rd floor of the courthouse. So if anyone calls and says, hey, I'll meet you out front of the courthouse, you can give me the money, that's part of the scam. And also he says that they will never ask for or accept payment of gift cards. So if anyone asks you for a payment in this form, it's definitely a scam. If you do receive a call and you have any concerns, tell them that you're going to hang up and call the Sheriff's Office. What they do is they have the number set up so it looks like they're actually calling from the Sheriff's Office. They'll say, well, look at your caller ID and look at the Sheriff's Office number. You'll see that we're calling from the Sheriff's Office. That is not the case. So just say, well, you know what? I will hang up and I'll call the Sheriff's Office directly just to confirm. So wanted to make people aware of that. The person I was speaking with last night, they were asking them for $2,000. So just let know that this scam is available out there. Also, this past week, last week, I was not at the board meeting. I had the opportunity to attend the 2021 CCAP, excuse me, CCAP Center for Excellence in County Leadership Program. CCAP is the Association for County Commissioners of Pennsylvania. It was a great program, a 2.5-day program in Harrisburg. Learned many things that I hope to apply here in my role as a county commissioner around communication, leadership, decision-making, and so forth. So I'm appreciative of the opportunity to be able to go there and learn more to be able to become a better leader and a better commissioner. That's all I have. Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera. Appreciate your comments, especially outlining the details of that scam. Just real quickly, I was thrilled to participate in the barn event as well and love the idea of the Barnopoly. I made the note and the paper picked up the comment that one of the things people learned about is supply chains last year and even this year. They're still not fully back to normal, excuse me, but that's especially true when it comes to our food. And so one of the things people did, and I talked to Ed Weaver at Weaver's Orchard, he picked up customers last year because people realized, you know what, I need to buy local. And many of our local farm stores, wineries, etc., I believe are actually going to benefit as a result of that experience and that learning. We also participated in MHDD's annual Strike Out the Stigma program with the Reading Fightin' Phils earlier this week. Great event. It was a little cool on Tuesday night, but hey, it didn't rain, and we were able to enjoy a great time and bring attention to the issue of mental health. I also will be participating in the event with Berks County Library System this Saturday down at the Village Library. But I want to close with a very different type of story. There are a lot of bad stories out there. Read a newspaper, read social media. You can find out about some pretty horrific things, whether they're here in Berks County or the city of Reading or outside. But I want to focus on a very good story about something that happened to me and to my executive assistant yesterday afternoon. Getting ready to head home, jumped in my Ford Escape, started driving down Washington Street, and all of a sudden my tire pressure light came on. And I thought, well, hopefully it's just dropped below the minimum. But I went about another 100 feet and I could feel the wheel pulling to the curb. And anybody that knows Washington Street at rush hour, it's not exactly the best place to be stuck with a flat tire. And so I got as close to the curb as I could. I turned my flashers on, got out of the car. Sure enough, the driver's side front tire was completely flat. And so I opened the back, started to get my spare donut out, and all of a sudden, a car pulls up behind me. I don't know the gentleman, a young Latino man, and quite frankly, broken English. He came up to me and he said, "Can I help you with your tire?" And I said, "Sure, that would be great." This guy knew exactly what he was doing, and he took everything, took it over. He then said, "Please, can you have Mary?" He didn't say Mary, he said my wife, but he didn't know. Get out of the car. He was concerned for her, seeing all the other cars coming down Washington Street. So I went around, Mary got out, stood on the sidewalk, and he fixed the tire. Didn't fix the tire, he replaced the tire with a donut. I tried to pay him. He said, no, I can't take anything. And as one final note, before he left, he pulled his car, and Mary said he must be from New York City. He just pulled his car out into the traffic so that Mary was able to safely get back into her car. I don't know his name, but there are good people out there that do the right thing for the right reasons. And I want to publicly recognize this young man for stepping up and being a good Samaritan. So maybe when you think about or hear about some of the bad things, you'll think about this story that took place to Mary Buer and myself yesterday afternoon, right here in downtown Reading on Washington Street. There are good people in Reading. There are good people in Berks County. And we were blessed to be able to meet one of those really good people yesterday. That's all that I have. Are there any comments from our row officers? Hearing none, I will recognize my executive assistant, Mary Buer, to read public comment.
Thank you. John Archer, the Spring Township. The subject, the constant focus on the Berks County Jail's incarceration of prisoners. From the barrage of continued criticism of the number of individuals incarcerated in the Berks County Jail, it would seem that this subject is simply an attempt to capture the moral high ground over our county's officials' decision-making and efforts to maintain public safety while operating the jail as prudently as possible. The moral high ground that should be promoted and projected is one that focuses not on the condition in which unlawful individuals find themselves as a result of committing a crime, but rather one that focuses on the promotion of criminal act aversion. Proper efforts made to minimize crime would end up saving the county time and a lot of money in our criminal justice system, as well as truly helping those individuals who need help in their decision-making to think long and hard before committing a crime. The Berks County Commissioners do not determine who becomes incarcerated in our county jail facility. This decision is made by the individual who decides to break our laws, as well as the court's judges who determine the sentencing based on current regulations, policy, and any special considerations. There would not be a need to incarcerate any person if that person chose to, number one, not commit a crime against some victim, or number two, not to place other individuals in harm's way by driving under the influence. Unfortunately, we all should know that there are a number of individuals who choose to ignore the law and take the risk of getting caught and then having to face the possibility of going to jail in order to try to prevent the individual from doing additional harm. So while it is certainly appropriate to be concerned about inmates' health and well-being during their time of incarceration, granting special privileges to them, such as limiting weekend stays, will only be a path to increasing the probability of continued non-compliance and additional victims. Crystal Kowalski, why I'm missing. Good morning, Commissioners. My comment is on our future ability to comment. At the June 22nd operations meeting, a suggestion was made to consider adopting meeting guidelines from Montgomery County. Here are some guidelines about public comment that Berks does not currently follow and my concerns about adopting them. All speakers sign in at the beginning of the meeting. Will there be a plan in place to allow people to address an issue that arises during the meeting or to voice their support for a previous comment? The comment must be germane to county business. County business is considered matters which are currently under commissioners for consideration or which may come before the commissioners for consideration. The determination as to which comments are germane is to be made by the county solicitor. Disputing the county solicitor's opinion is not permitted. This policy gives the solicitor the power to silence and suppress comments the board finds challenging. This can easily become censorship or be interpreted as censorship. It also limits the introduction of suggestions and new ideas. Comments will be limited to 2 minutes. We have always been permitted 3 minutes at in-person meetings. Some of the more detailed arguments for keeping Berks-Hyman County hands would not have been possible to effectively communicate in 2 minutes. If these are the guidelines being proposed, I ask you to vote no. Please do not restrict public comment. Montgomery County also allows the editing of recorded meetings. Please do not allow this. Public comment, recorded meetings, and detailed minute meetings are critical to transparency, the public's right to know, and to a free exchange of ideas. Thank you. Fred Zencraft, Senior, Berkshire Heights. Greetings, Commissioners. A free and fair November 3rd, 2020 election would have continued and improved upon President Donald Trump's accomplishments, some of which follow. Fair and reciprocal trade. Secured historic trade deals to defend American workers. Reached a written, fully enforceable Phase 1 trade agreement with China on confronting pirated and counterfeit goods. and the protection of American ideas, trade secrets, patents, and trademarks. China agreed to purchase an additional $200 billion worth of United States exports and open market access for over 4,000 American facilities to exports while all tariffs remained in effect. Achieving a mutual agreement with the European Union, EU, that addresses unfair trade practices and increases duty-free exports by 180% to 420 million. Secured a pledge from the EU to eliminate tariffs on American lobster. The first United States European Union negotiated tariff reduction in over 20 years. Scored a historic victory by overhauling the Universal Postal Union, whose outdated policies were undermining American workers and interests. Engaged extensively with trade partners like the EU and Japan to advance reforms to the World Trade Organization, WTO, issued a first ever comprehensive report on the WTO appellate body's failures to comply with WTO rules and interpret WTO agreements as written. Blocked nominees to the WTO's appellate body until WTO members recognize and address long-standing issues with appellate body activism. Submitted 5 papers to the WTO Committee on Agriculture to improve members' understanding of how trade policies are implemented, highlighted areas for improvement, improved transparency, and encourage members to maintain up-to-date notifications on market access and domestic support. The current administration policies will have a negative impact on these positive accomplishments to the detriment of our posterity. Thank you and Godspeed. Dwight Wegman, Lower Heidelberg Township. All of our county commissioners deserve credit for their candid remarks and rationale concerning their objections to the proposed need to pursue the initiation of a county-wide real estate appraisal at the present time. Of particular note was Commissioner Leinbach's statement that what is really needed is the complete elimination of property taxes, especially at a time in which most of these taxes go to supporting public education system indoctrination and its overall failures to prepare students for real-world challenges in an intelligent manner. And that concludes our comments.
That closes our comment period. And at this time, I'll give an opportunity for commissioners that want to comment. I'm going to comment on one area. I need to clarify, no one, myself included, who brought the issue up, suggested we adopt the Montgomery County comment policy. I specifically highlighted the segment that deals with the germane nature of the comments. And I might add something else. Every other county meeting, our election department, our ops meeting, other public meetings already have a germane requirement. If you've attended those meetings, you'll notice in the opening comment that it says comments must be germane to the agenda, period. Look, we are county commissioners. We have a responsibility to deal with county business. And I feel strongly that comments should revolve either around county business as it relates to the current agenda or potential county business in the future. The idea that the Berksheim wouldn't relate to potential county business in the future is ridiculous. We're not talking about trying to stop people's comment as it relates to the county government or something in the future that may impact the county government. But we also, I can't speak for my colleagues, I don't want this to be a forum for every possible topic in the world that could be considered. I'm not interested in that. That's not our role. I'm interested in making sure that the public that have concerns, issues, comments relative to county business are able to do that. I will continue to push for the change. And again, no one has promoted adopting the Montgomery County comments, specifically revolved around the germane nature of the comments and making that a requirement, not just in our other meetings, but making that a requirement here in the commissioners' meeting as well. Some people participated. We discussed this at our ops meeting last Tuesday, and our solicitor, along, I believe, with our CAO, are working on a draft of what we might consider as an amendment to the Berks County comments. So hopefully that helps clarify what was said and what is being considered versus the comment that was made about this. That's all that I have. Commissioner Rivera, do you have anything?
I was just going to touch on the same topic that you did, so I won't repeat. I am in agreement with you, so I have no other comments.
Okay. Thank you very much. Motion to adjourn?
Motion to adjourn?
Second, and the meeting stands adjourned.